Hello, I'm Dr. Moody Alexander, the son of Dr. Wick Alexander, the founder of the Alexander Principles, speaking on behalf of American Orthodontics. Today we're going to talk about bracket placement using American Orthodontics Alexander Long-Term Stability or LTS brackets. The Alexander LTS bracket system from American Orthodontics utilizes bracket types selected to enhance clinical efficiency, increase interbracket distance, speed the correction of rotations, minimize chair time, and enhance patient comfort. Twin brackets are used on upper centrals and laterals, while wing brackets are used on cuspids, bicuspids, and mandibular anteriors. The quality of your finished results begins with the quality of your bracket placement. The more time and effort put into placing brackets properly will result in a much more quality finish in 18 or 20 months. There are three factors to take into account when placing your brackets. Number one is bracket height. It is extremely important to make sure you measure each bracket for the proper height. Number two is bracket angulation. Each bracket should be placed parallel to the long axis of the tooth in order to achieve proper angulation. And number three is the mesial distal positions. If it's a flat surface tooth, centrals and laterals, you put the brackets in the center of the tooth. For cuspids and bicuspids that have a curvature, you want to place the bracket at the height of contour, not at the center of the tooth. If you do this, then no matter where the tooth is at the beginning, the wings will rotate the teeth and eventually move them to the exact positions they should be in. Now I'll show you how to properly place the brackets. We have a typodon here, our brackets, and our placement guide tool. The first bracket we're going to place is the maxillary central twin bracket. Pick it up, apply your adhesive, and place it in the center of the tooth. Remove excessive adhesive. Once it's in its position, take the placement guide to check for proper height, which for this bracket is 4.5 millimeters. For all other brackets, use the placement guide tool to check for proper height. The next bracket to place is the lateral bracket, which has a ball hook. It is placed just like the central, except that it has a height of 4.25 millimeters. Next, we place the right cuspid bracket, which is a single bracket with wings. This is also the first bracket placed on a tooth with a round surface. So, we place it not at the center of the tooth, but at the height of contour. Make sure it's parallel to the long axis and is at a height of 5 millimeters. Now we place the first bicuspid bracket, which is also a single bracket with wings. Again, it is placed at the height of contour at 4.5 millimeters. The second bicuspid bracket is placed at 4 millimeters. From here, we move to the most important bracket placements, which are the lower anteriors from cuspid to cuspid. By placing these brackets accurately and with the proper angulation, we can properly spread apart the roots of these teeth. Start with the central incisor, which is a single bracket with wings. Place it at the center of the tooth with a height of 4 millimeters. The next bracket to place is the lateral bracket, which has a ball hook. It is placed just like the central with a height of 4 millimeters. These are the four most important brackets in the whole case. Next, place the mandibular cuspid, which is a round surface tooth, so you will want to place it at the height of contour and not at the center. This bracket should be at a height of 5 millimeters. Regarding angulation on the lowers, the central incisor is 2 degrees and the lateral and cuspids are 6 degrees. Again, this spreads the roots apart properly and is a big factor in the long-term stability of the 6 anterior teeth. For more information on American Orthodontics Alexander LTS braces, visit americanortho.com/Alexander. To learn more about the Alexander discipline, you can visit alexanderdiscipline.com.